Don't let spider veins and varicose veins keep you under wraps this summer. Bair Medical Spa has a treatment program that will get you moving. Kristie Bair and Dr. Dean Bair join us this morning with the details. Good morning to both of you.
Good morning.
You have amazing legs, may I say. I've always thought that.
Thank you.
Really, you do.
You.
So this is you're good to talk on this topic. I want to talk first about what spider and varicose veins actually are and what the difference is between the two.
Spider veins are the tiny little superficial veins that look like spiders on your skin. You know, those tiny little red marks.
Yeah.
Varicose veins are larger veins that are lumpy that you see going typically up the calves, sometimes up the thighs.
Okay, so then how does Bair Medical Spa actually treat these kind of veins?
Depending on the size is exactly what he's talking about. We treat them either with lasers. Typically spider veins we treat with lasers. Varicose veins with a technique called sclerotherapy.
Okay, so let's do spider veins first. Let's talk about that. Is it easy? Because you said you just get it with a laser. Is it just something that's simple?
Not particularly simple, really. Because it's a network, and so you may get this part and this part continues to be fed with blood. So it is a process. And oftentimes injecting those is a more efficient way because you'll inject one branch and they all fill up with that medication that collapses the veins. That's sclerotherapy.
So now talk a little bit more about that, about sclerotherapy. How many treatments do you actually have to have for it to actually make a difference?
We usually do 2, and sometimes it takes more than that to get all of them. Again, you try to get all of the branches filled, come back in a month, some of those branches may still be filled.
And they kind of do look like branches. I mean, that's actually a good way to put it. They're like branches on the tree. So
exactly.
So overall, you'd expect about 2 treatments. That's the typical?
2 or 3 is typical.
Okay, well, let's take a look at some results. I want to see some before and after so we can really see what the difference. Oh, yeah. Wow.
Now, this is you can see it's lumpy. That is a varicose vein. And that's about a week later. So there's a little bruising. But that bruising fades away. The vein is collapsed, and that should be gone essentially forever then.
I see. Well, Dr. Bair, let me ask you this. Could you use these kind of treatments on other parts of your body, like the face?
Not really.
Not really? Okay, so you really want to focus on
legs? We use laser on some of the spider veins on the face. And that works well, but not the injections.
Okay, so overall you really want to focus on the legs for this. What would be the downtime after the treatment?
You have to wear compression hose for a week afterwards. That's so when I inject that or I use the laser to seal off that blood vessel, that the compression hose keeps that closed so that the blood doesn't start to flow back.
I see that.
So that's really the downtime.
Okay, so overall, just a week. And so you could still wear your clothes, you just want to wear looser fitting clothes, I guess, right?
Right.
So you're a little more comfortable.
Right, or, you know, you can buy sheer compression hose.
Oh, you can?
Oh, yeah.
Okay, good to know.
Yes.
Because, you know, especially in the summer, we want to wear dresses, and, you know, but a week is really not a lot of time.
Right.
It's really not a lot of time. What about side effects? Are there any?
As you saw, there's bruising. That's the main side effect, actually, is some bruising. And the medications that we use now are better in that some that we use, particularly concentrated saline solutions, saltwater solutions, oftentimes cause the blood to leak out but stain the skin. What the solutions that we use now are safer, much more comfortable, less risk of that sort of tattooing or hyperpigmentation of the skin.
That's good to know.
That's the downtime for sclerotherapy. If you're doing a spider vein with laser, and for example, again, my daughter's going to love this that I tell this, but she had, which is real typical in women, little spider veins around her ankle and around her knee. She's very fair. She had the laser treatment. For about a week, she said she looked almost like she had a burn. It wasn't a burn, but kind of looked like a burn. Then she calls me one night a week later and she said, wow, I just laid on the couch and flipped my legs up, and she said, they're gone. She said, the redness is gone, the spider veins are gone. She said, I hadn't even noticed that. So for about a week, she, you know,
That's great.
Yeah.
So she saw the result. Now, does this last? Is this a permanent treatment, or do you have to come back again?
For those veins, for her, it was. That was
good.
It. You know, no, she was in her 30s. So she's young, so.
If you have varicose veins, spider veins, you have a tendency, so typically what happens is that we'll treat some, a year or two later people come back and go, oh, now I've got some more. It's
right. It's just
the
part
way
of
it is.
Yeah, if you have them once, you'll probably have them again. So a different area maybe than that was already treated. But once you do get it treated, it does take care of it. So that area at least is taken care of, right?
Yes.
Yeah. Well, that's comforting to know. And I know. I mean, and I think I think it's a wonderful thing that there's an opportunity to fix it, because I think there's a lot of people out there who are very self-conscious and maybe a little embarrassed about it. But it's a very typical problem. I mean, you see a lot of it, don't you?
Oh, yes.
So you're not alone if you're feeling like, oh my God, I'm embarrassed. So many people out there are dealing with it, and there's a solution which makes it all the better. So where can our viewers get more information?
Bair Medical Spa.com.
That's easy enough.
And 505-881-1532 is our phone number.
Okay, and if somebody's kind of confused, is this something that I should treat? Is it something that I should just avoid? Or which kind of veins do I have? Are they spider or varicose? You'll be able to help them out in a consultation,
exactly.
right?
Yep. Complimentary consultation. Come in, take a look, and then that's also an opportunity to let them know how many treatments it's going to take, exactly what to expect.
And maybe one of these days you can have the answers to how we can get legs like yours.
Oh,
please, I need some help. Thank you both so much for being here. And stick around, we're getting a little wild on New Mexico style. The Wild Spirit Wolf Sanctuary is coming up next.